Hey, Medicare beneficiaries. Here's a quick video to simply explain your Medicare options for parts A, B, C, and D. You'll be an expert in no time. If we haven't met yet, I'm Tim Gustafson. I've been a senior advocate and a Medicare insurance specialist helping people like you navigate their Medicare options since 2005. And one of the biggest struggles I see Medicare beneficiaries face is understanding the complexity of all the plan choices. I know you may feel intimidated and overwhelmed by the information overload, and that's why I created this short video designed to help you grasp your options and make an intelligent decision on what's best for you. So Medicare Part A is the hospital benefit. This covers you in the hospital for days 1 through 60. There's a pretty hefty deductible. In 2021, the deductible is $1,484. It also includes very limited home care and hospice. And as long as you or your spouse worked for at least 40 quarters or 10 years, there's no premium. Medicare Part B is everything else. It's all doctors, specialists, CAT splints, x-ray surgery, ambulance, MRIs, lab work, blood work, occupational therapy, physical therapy, chemotherapy, any drugs administered to you through an IV. I'm sure I'm forgetting a thing or two, but hopefully you get the point. With this, there's a pretty reasonable deductible. In 2021, it was a $203 deductible. And then it's an 80-20 plan. Medicare covers 80, you must pay 20. And the standard premium for Medicare Part B in 2021 was $148.50. Now, if you're low income, the state might help you pay for all or some of it. And if you have a pretty good retirement income, over $85,000, you're probably going to have to pay a little bit more. Now, with a Medicare Part C, these are known as the Advantage plans. These are all the HMO, PPO, those type of plans. And basically, you sign a contract with a private company, and it will at least cover all of your Medicare A and B benefits. But you signing that contract, you'll know exactly what you're responsible for as far as your copays and what you have to pay per service that is rendered. Medicare Part D, as in drug, is just that. It's your prescription drug benefit. They break down the drugs into 5 different tiers: your preferred generic, non-preferred generic, your brand name, your non-preferred brand name, and your specialty drugs. And then there's a standard formula. So you may have a deductible, and then you have your initial coverage period, and then you have a coverage gap or a donut hole, and then your catastrophic coverage. So when you get on Medicare, you have 2 choices. You can either choose to go with a Medicare Advantage plan, which should have no or low additional premium. You still have to pay your Medicare Part B premium. And this Advantage plan is going to take over as primary. So this would be the card that you show the doctor, the hospital, the pharmacy, and everything. You just have to pay a copay as the services are rendered. And with this, you do have a network of doctors, and you may or may not have to deal with a referral. Most plans in 2021 have gotten rid of the referral requirement. And all Medicare Advantage plans have a max out of pocket. What this is kind of like a stop loss. So they keep track of all the copays that you pay. And if something catastrophic happens where you rack up, say, a $2 million bill, you don't have to pay copays always and forever. There's a limit to how much you would have to pay out of your pocket. Now, if you do pay that limit, you still get whatever services rendered that you need. You just don't have to pay any additional copays. And Advantage plans usually include your prescription drug plan. Now, if you're a VA, you may not need it. But all plans, most plans also include extras. So dental, vision, gym memberships, over-the-counter items, hearing aids, telehealth, etc. And so your out-of-pocket cost or your expected cost would be your Medicare Part B premium plus whatever copays you pay. Now, the other option is to go with a supplement. Supplements are a little bit different. Your Medicare A and B remain your primary, and then your supplement is your secondary. So you do have to pay an additional premium for this, but you have no copays whatsoever. There's also no network or referrals are required whatsoever. And your maximum out of pocket is simply the premium you pay for your supplement plus your Part B deductible. Typically, that is not covered with a supplement. And then there's no prescription drug plan that's going to be included. And there's usually no extras. You may get a discount or a free gym membership, but that'd be basically it. And then the cost for your Medicare Part B, would be your Medicare Part B premium, your supplement premium, and your Part D premium. Asked all the time. They go, well, what's best for me? The thing to keep in mind is that there is no wrong answer. It's just a matter of what combination works best for you. And I can help. So click on the link to my calendar, and that way we can discuss your plan options today.